Dalia gonna give us her secret as well. Now,
Okay.
today it's really very dynamic, a new treatment.
Okay,
So-
please. Good evening. First of all, you can enjoy your meal while I'm speaking. I'm Dalia Sadiq Hassan. I'm an oral maxillofacial pathologist. Then I turned to the area of stem cell by my new project in PhD. I specialized or tend to specialize in cancer stem cell. Then I just get expert maybe as a junior scientist in or therapist in stem cell. So today my topic will be in management of cellular management of facial palsy. So what is facial palsy? The facial nerve is the seventh cranial nerve. It is complex nerve that provide innervation to many areas of the head and neck region. It contains motor, sensory, and parasympathetic called secretomotor nerve fiber. That is to say, nerve to the gland, whether the salivary or racemar. The facial nerve disorder can be either central in the level of upper motor neuron paralysis or peripheral after the nucleus or post-synaptic. So what is the etiology of facial palsy? The most common causes of facial paralysis may be viral infection to the facial nerve, may be due to head trauma, like car accident or so. Neoplastic causes may be parotid gland is the closest structure to the facial nerve. So parotid tumor and head and neck cancer may be an etiological factor for facial palsy. Stroke will act as central cause of facial palsy. Maybe facial palsy produced by doctor problem, doctor failure to treat accident trauma by doctor called iatrogenic. And last but not least, the idiopathic cause of facial palsy called Pell's palsy.
And COVID vaccine?
Excuse me?
COVID vaccine.
Yes, I read this in
How
in
many?
literature. Yes.
The daughter of my
Yes,
brother,
it happens.
23 years,
Yes.
she get the COVID vaccine.
Vaccine then.
She get a bad paralysis.
After
Yes.
how long?
After 2-3 days that she get
Yes,
the
Yeah, you
yes,
saw
it's
that?
present in the
We
literature.
see a lot of shingles.
Maybe
We did see shingles after vaccine or mostly vaccine or after even.
maybe
COVID.
due to the fact that the virus, a certain virus of shingle and COVID go and be latent in certain ganglia and then be reactivated by various causes, maybe head stroke or even the vaccine.
the case that I said to you.
Yes.
You remember?
Of course.
15 years old
Too young.
girl.
Too
She
young.
get the vaccine. She get completely
So
middle cord, cervical middle cord, mielite, transverse myelitis, basta, finito. She's like a vegetal now. We'll try to do stem cell and we'll see what's happening.
Then she
Yeah.
recovered?
No, here you go. So 8 months now she's on the, and she was with the stomia for intubation for 4-5 months. Then now the diaphragm started to work, but she's completely paralyzed.
That is very
Post-COVID
Yes,
vaccine,
yes.
14
Yes. Not in
years
the
old.
literature.
Did you try with her stem cell?
What we are doing now.
We're trying to do this.
Mhm.
Not yet.
You take it from the bone or from the fat?
It's still not.
Plant, just plant.
It's better to take it better to use both. I'm sorry, just
Yeah, tell me.
it's so miserable case.
Yes.
Make it both from the blood and from the fat. From the blood, BRP, and from the fat, take it the same day, as well as the stem cells,
Yes.
and then give both.
Okay.
And in this case, try to get anesthetist and put it in the
Yeah,
CSF.
Yeah.
With a mechanism, of course it's lumbar, don't go up, okay? But you have to put him in this position after the injection, so the gravity makes its way for that. And trust me, both, because BRP had more these cross factors while the stem cells.
It's like a booster.
Yes.
The capilla
Put
work
him
like
in this
a booster.
position,
Yes.
get injection, inshallah within 4 to 6 weeks.
I know this, but now the problem is, believe me, sometimes I did for charity, because one of my patients sent me the photo and told me try to help this woman. So I speak with our friend, Professor De Corrent,
Mike.
Mike. There is a cost. Now the parents, they start to say, no, because we read that she can also die with the stem cell. I told, listen, your daughter, if she will not do, and now it's 8 months, as soon as possible, nothing happened.
Too late.
I prefer that she die, that I keep her for the life like this. I told them like this, so they stopped it.
Okay.
Let's keep going.
Carry on, please.
So this is the photo or picture, or maybe illustrated, to just notice the difference between the affected side and the normal side. Of course, yes, there is a dropping in the smile line of the patient, and the eye couldn't be closed normally, and the patient couldn't wrinkle his forehead. Maybe what is the signs and symptoms of facial paralysis? Here the patient, you notice her eyes going red due to the cornea, maybe reach until ulceration of the cornea, and dropping and the loss of facial expression and inability to wrinkle or brow, the dropping of the eyelid, inability to close the eye will be constantly just open.
Also in the night, means
Yes, the patient cannot close the eye
So-
all the time. So the light,
Dryness.
yes, dryness occur, and the eye start to be infected and irritated, inability to bump the cheek. So patient will start to feel insecure about their appearance and aesthetic appearance, and that's why. So what are the prognosis and treatment options? Severity of facial palsy can vary depending on the underlying cause and the extent of muscle damage. Mild cases may only cause minor facial weakness, while severe cases can lead to complete paralysis of the face and loss of the facial expression totally. And as I said, patients start to feel shamed or insecure about their appearance. There are several treatment options available for the facial palsy, including traditional treatment, which are physical therapy, medication, especially in the onset of the facial palsy, and then maybe surgery option also included to just decompress the nerve, or maybe to do a graft in some instances. However, the effectiveness of these treatments can vary depending on the cause and severity of the lesion, because some patients may experience long-standing and persistent symptoms. That's why we just thought about cellular treatment and cellular treatment option of facial palsy. Maybe a bone marrow derived stem cell, you can use it. A study in Brazil in 2015 investigated the role of mesenchymal stem cell potentiality in nerve regeneration among rats with unilateral facial nerve injury, and the results showed significant increase in nerve diameter explained by ability of the mesenchymal stem cell to assist in nerve degeneration. The literature said that there is a very regenerative role of the mesenchymal stem cell in nerve degeneration, because they acting in the nerve diameter increasing.
Sorry, which route?
In the rat, they inject it in the trunk of the nerve.
Direct.
Yes,
nerve
direct.
injection.
Okay. Another studies also use the platelet-rich plasma, which are PRP, in case report study held in Hungary, 2017, using PRP. The peripheral blood mesenchymal stem cells they found it multipotent, and plasma contain, of course, growth factor involving in tissue regeneration. The transplantation of the peripheral blood mesenchymal stem cell plasma promote the recovery of the paralyzed facial muscle in Bell's palsy. The treatment resulted in both morphological and functional recovery, including voluntary facial movement. The findings suggest that the peripheral blood bone marrow plasma has the capacity of facial muscle regeneration. Here are the steps to get the PRP. You take the whole blood, and then you do separation of the platelets by centrifuge. Then you do second spin, and then you get your product is PRP. In Poland, they use adipose-derived stem cells, which gained by the adipose tissue. You do liposuction, and then they found it an attractive cell source for tissue regeneration. Why? Because they have self-renewal capacity, they have capability of high growth rate, and they have multipotent differentiation property. That's to say, it has the capability to transfer in any cell type. They can be easily also isolated, as I said, by subcutaneous adipose tissue, by safe and conventional liposuction procedure. They also easily being purified and propagated in a culture. The adipocyte stem cell can influence accelerated nerve regeneration, and they also can promote angiogenesis. They secrete number also of growth factors and cytokines, making them a very attractive, as is to say, cell source for the treatment. So a new cellular therapy is the stem cell derived from human exfoliated deciduous teeth. Human exfoliated deciduous teeth. It's a mesenchymal derived stem cell. We obtained it from the pulpal part tissue of the teeth, of the deciduous teeth. Then across many laboratory sophisticated maybe steps, we can gain stem cells.
That's from the tooth?
Yes.
Oh, that's special.
Where is the rest of the? Okay. So also there is extracellular vesicles, the favorite of Fatma. It's a product also gained by several laboratory steps. They use it also in the. I'm afraid some of the just appear. Can you?
You good with it? Can you see the problem with her or call Moses?
Uncle Musa.
لا ما عارفة ما باينة معي.
You went ahead of yourself?
لا في ما doesn't appear. Why? I don't know why.
They maybe not downloaded yet?
No.
Hmm.
So,
They cannot open it.
sorry. Can you call him?
You go back.
We're calling the
coming.
person.
If you go back to slideshow and then you
Yes, maybe.
then start from the one you want to show to the screen,
Why?
a second to the left.
Here?
No,
No.
left.
From current slide.
Again. That one.
Oh.
Why it doesn't appear? No. Here is supposed to be some. There is valid information are there. Do you have the flash? Yes. I have the receipt.
Very good. Have full of stem cell. Loaded with ozone.
You're going with the cream.
The cream is ozone. This is we called actually
Halal?
Why? There is
Surah.
something written here.
Ozi, عبارة عن very popular in Syria. It's kind of like mixture of meat on it. And
You're vegetarian?
You're vegetarian. You can take it without.
This one. Thank you.
Sorry, we need to make sure.
Can you
You know.
please just make sure? Mm-hmm.
Where you know?
Yes.
15, I
This is my
think.
presentation.
Yeah, what page you are now?
Can you?
I think 15 was missing.
15?
Yeah, no. Yeah, 13.
No, I think from the after the adipose. Yes, from here.
Yes.
From here.
Oh,
Yes. Thank
okay,
you.
perfect.
So you got that.
Yes.
Stay around here to see, make sure it's good.
So the oral mucosa, gingival lamina propria, contain a small population of neural crest origin stem cells, including mesenchymal stem cell. After isolation and in vitro culture, this neural crest derived stem cell can differentiate. Please just focus into classical neural cluster lineage, such as neuron and Schwann cell, as well as various non-neural cells such as melanocyte, endoneurial, fibroblast, and subpopulation of bone marrow and dental mesenchymal stem cell. A number of studies have investigated the stem cell transplantation, both in combination with the nerve conduit and alone, demonstrating significant beneficial effects on rat facial nerve regeneration. The total word need to be said here that stem cell obtained from deciduous teeth can be acting as cell source for treating nerve of facial nerve, causing nerve regeneration.
That's great. Yeah,
Yes.
that's-
A study held in Brazil in 2018, they utilized experimental rats with crushed, they did crushed facial nerve culture, and they have used SHED, which is abbreviation of the stem cell derived from human exfoliated deciduous teeth, have been observed produce neurotrophic factors. And that is the interesting thing of SHED, because they have neurocrest sharing origin. So they act as neural growth factor and brain neurotrophic factor and glial cell derived neurotrophic factors. This production of neurotrophic factor has shown therapeutic benefit in various diseases. Of special interest of this study, SHED have been demonstrated to differentiate to in vitro Schwann-like cells. That's why they may have great attention and may be used further in upcoming researches. And this is me working in the MBRU laboratory producing and growing stem cells.
How,
Wow.
how
Yeah,
you know,
different.
that's each pulp, how many cells can you extract and after that once, how long it's taken, in which cycle you are using it?
So
Which
which massage you grow them until maybe 3 and 4, 5, 7 massage, and then you administer them.
And then they
Yes.
extract
Yes, extract
how
them and grow
how
them.
many cells? For example, from one pulp, how many cell you can come?
Maybe they wrote in their paper that 2 to 4 million.
2 to 4
Yes.
minutes. So to do a treatment, for example, once we are doing the cell therapy, we need 100 million.
Yes.
You need to
That's why
multiply-
they just acting on rats. Maybe this is
Yeah, because
enough.
once we are doing in human,
Yes,
the
you need
number
multi,
is
yes.
yeah, it's
need to
so-
be more. That's why.
Okay.
So moving on, are they the best source of mesenchymal stem cell? Bone marrow mesenchymal stem cell have already been shown to potentiate neural regeneration. However, SHED are shown to have higher potential for being simpler with higher rates of cell proliferation in vitro and with a better potential for neural regeneration, possibly because they are directly, as I said, derived from the neural crest. In this study, they showed potential role of SHED for in vivo differentiation, more appropriately attending the demands of the microenvironment. Another study held in Korea recently in 2021, treatment of idiopathic facial paralysis, that is to say Bell's palsy, secondary paralysis. They used extracellular vesicle, the exosomes. They recruited 7 patients, real patients, not rats, in safety pilot study that utilized innovative treatment approaches with beneficial safe method to enhance the nerve regeneration, especially in cases with persistent symptoms. Their design of study, the exosomes or extracellular vesicle was injected into the area of the facial nerve main trunk, which is in the area of the parotid, yes. On the affected side, they accompanied it by drip on a visit during they
By
use
drip?
yes. They give the patient drip, accompanied by drip on the visit during 1 to 2nd and 4th week. All the 7 patients showed obvious improvement with the use.
You mean IV drip?
Yes, IV.
That's why I'm asking.
Yeah, yeah.
Drip,
Yes,
uh,
I
drip,
will.
Yeah,
drip,
yeah.
drip.
IV.
So they did the trunk and IV.
Yes,
Okay.
both.
Local and
So,
intravenous.
yes.
Yeah.
All right.
So their findings are supported by very recent study, the former study in July in 2023 in China. They proved that mesenchymal stem cell derived exosome promote recovery of facial nerve injury by their healing properties based on their promotion of axonal regeneration and myelination, pause mechanism, ability to decrease localized and systemic inflammatory response as well. All this is supported by research that resulted in mesenchymal stem cell exosome in control by new modality, which is macrophage plasticity, to help them polarize into anti-inflammatory phenotype, which inhibit the production of pro-inflammatory cytokines. So the exosome will work in the macrophage plasticity to polarize them, to enhance them in the role of the anti-inflammatory phenotype and production of pro-inflammatory.
Which type of MSCs were they?
Bone marrow. They are bone marrow.
Bone marrow mesenchymal
Yes.
stem cell. But is there any control group? Because majority of Bell's palsy, they recover spontaneously without treatment as well. So if you don't have any control group,
Yes.
there is no reason
Yes.
that's
They are recruited the 7 patients who were have persistent symptoms.
so it
So
was
not-
a cycle of the
Yes, yeah,
it
not-
was not a new
Yes, not new onset. So this is laboratory maybe steps to obtain your exosomes. Very a little bit complicated. So I reached the umbilical cord mesenchymal stem cells. A study recently executed in Korea, published very recently in 2023. The patient recovery from Bell's palsy after treatment using uncultured umbilical cord derived mesenchymal stem cell, which is a case report study. They treated a patient who suffered for 7 years from facial palsy by uncultured umbilical cord derived mesenchymal stem cell transplantation. Why they use uncultured one? Because previous studies stated that culturing of the mesenchymal stem cell undergoing changes in their properties, cytokines and protein secretion due to cell aging by the culturing. That's why they use uncultured umbilical cord. This is the step, yes. This is a step to gain umbilical cord, either by tissue or.
Do you know that as well as the not only the umbilical, the fat cells liver age?
Sorry?
What do you mean by that?
Fat cells,
Uh-huh.
when you take the stem cells or whatever therapy, when you take, you say from the bone marrow
Uh-huh.
or from the fat. Bone marrow is an aging cell.
Yes.
So anyone
Adult.
more than 30, the line going down.
Yes.
30, not 40.
Yes.
So
Ah,
until
yeah,
30,
that's
take from bone marrow. You are dealing with 50,
Yes. Yes.
go to the fat, because fat never age.
Yes.
I'm sorry, it's just
This is a very
you can pay me for
important
this.
and crucial.
You can pay me for that.
I
Thank
think
you
it's
so much.
debatable. Yeah, but also, I mean, this is a very interesting study
Yes,
because
that's fine.
if you can take from fat, then it's fine. You can just by enzymatically extract them. But I don't know how they did.
Uncultured.
Because you are removing from the cord itself. So you need to do some kind of
Yes, yes,
manipulation
yes.
to get the cells. So how did
Yes.
they get these cells?
I can show you the paper.
Yeah. I mean, it's
So how
really
did
a
they
very
do it?
Interesting, very interesting. So
is it
they
uncultured or they didn't induce anything? You know that sometimes we give we do the induction or it's a culture because anyway
is
once
this the image from the paper themselves?
No,
this is
to
your-
illustrate.
okay.
This is to illustrate just.
Okay.
Then
Because
there
this
is
is culturing.
yes.
So
Yes,
you put
yes.
it on the plate.
So the study design of their
Amazing.
study, they prepared a stock of 4 ml injection solution consisting of uncultured umbilical cord derived mesenchymal cell. Before injection, the prepared 4 ml injection solution was divided into 4 1 ml ultrafine insulin syringe containing 1 ml each. They inject the injection solution evenly over the affected side of the patient face. Each side was injected with
Of the face? Not
yes, and
oh,
of the affected area of
Yeah,
the
yeah.
yes.
So not the.
They make a marks. They made a mark and then injected all at the depth of 0.4 to 6 centimeter. A total of 16 injections were performed in an interval of 2 months. The outcome: the patient received total of 8 treatment at 2-month interval for 14 months and was followed up 18 months after the end of the treatment. The Bell's palsy did not recur during this period. After the treatment and transplantation of the cell, the patient experienced rapid improvement.
Do they have before
And
and
this
after
is
picture?
for one. Yes, I have the picture, but I don't know.
How many cells? Because they only mention how many ml and how many cells do they have
They-
and how they.
Maybe
Come up with
I
that.
prepared the all the studies, so I will share it with you. But I don't
Excuse
know.
me, I can just tell you from other studies, okay, 10 million cells.
No. I mean, in this study, because they mentioned
Ah.
uncultured
Uncultured.
1 cm. It looks like that they
Very little
only
amount.
injected
Small.
blood or something else. It's not
Morphine jelly.
the septum jelly or
Maybe-
something.
maybe.
It's not
They
the
didn't even mention
mesenchymal
Morphine
stem
jelly.
cell.
Ah, ah.
Because if we go for mesenchymal stem cell, we need to come up with how many cells and how these
Count.
the things that they mention uncultured and based to ml. It looks like that they only straightforward inject something from Morphine jelly or the blood. Not
They didn't
in
mention.
You know, I was just wondering, like you this before, when somebody talked to him and they tell me that I inject here 2 ml. So I tell him, okay. Then I ask him the same question: how many millions just in this 2 ml? So I discovered that most of their work is on spot, as I told you. They go to the patient, get the fat from him,
Directly.
take the
give
fat
them.
directly
Directly.
get to the lab or to the bank, and they separate the
True. And they have no idea of
the
the
cells,
number.
separate it, bring it to you.
Yes.
You understand?
And
They
they have
don't
really
mutate,
no
no
idea.
mutation.
Yes, yes.
When they mutate, it takes
Mutate.
1 month to take the million.
Expand, yeah.
3 weeks
million.
minimum. 3 weeks.
That's called
I mean,
SVF.
whatever accordingly,
Expand.
because it's
So
a.
just they take the cell, give it to you,
Yes,
basta.
I give it to the bank. This fat, just a couple of hours.
Yeah.
They bring you 2 ml, 4 ml.
Yeah.
Okay, then I injected that once. So that's why we normally now act as 4 ml, because I work on this rapidly than the bank and the mutation and thousands, millions, because this is rapid and gives very good actions,
Yes.
and money is less because the bank takes
Because-
half of my money.
Divided. So
But this is a
actually,
mixture, not a pure stem cell. This is like a mixture of all cells, including stem cells.
Including stem cells, yes.
It has a stem cell in,
It has-
but
yeah.
it is not a stem cell. That's
Yes,
the reason.
some
It's
cells-
not a-
No,
Exactly,
They
a
separate the
stem
stem
cell.
cells, and according to what type, because you have several types of stem cells,
Actually,
but you need more. It's a fibrous, you know.
Can I interrupt?
Please.
I have a full lecture about different type of mechanical separation of stem cell, enzymatic separation of stem cell, the difference between the SVF of each, and the difference between the SVF itself and expanded culture cell. There is a full lecture on the 18th of this month, so
But
I
this
don't
is-
want to
but
disclose
this
it
is-
now.
You don't give this, you have to pay for that one.
Everything
This is
you
mainly
That's
for the
paid
lab doctor, not for
Valuable
us. You know, I tell him
information.
this, please, I need
No.
stem cells from this fat.
It is,
So
it is
he
for
take
the
me
doctor.
for what? I tell him for CSF or for whatever. You know what I mean? The point we are team. You know what I mean? So what he meant is a huge things, but it's not my part.
Yeah, but when
It
you
is,
make
it is
this
for
effort,
everybody.
yeah, but when you make this effort, you can understand what the lab is giving you,
yes.
under which criteria,
Yes, sure.
and
I don't
you
understand
can,
this. I mean,
no, and you
uh,
can as a clinician then assess which one is better in terms of outcome. Because if the other guy is just working on himself, depending on what he has, and not communicating the number or the method or what it's supposed to be, or you don't even know what the mixture is, then how are you going to assess? How are we going to help
Measure
the
outcome.
community to help and give something back to the West that is doing everything and assessing and doing these clinical trials and everything, and you don't even know what is there. And I've seen work that is being done here and products that should not be. This is a failure. It should not be introduced into patient and it's given to patients.
And it's very dangerous.
So it's really, I mean, yeah, according to what we know, maybe we're inventing something new. Maybe these mixtures that are better, but we need to document. You need to know what he's doing. You need to take the time to understand what is there inside.
So you have a lab for
And-
this?
No,
there
he's,
is-
No,
he's,
but-
he's done a huge effort to understand what stem cells are and everything, So
We will show you.
he's really an expert,
We have
theoretically.
day 3.
He has
day
never
3.
worked in the lab, but
am
I
not
really
working
like
the
his,
lab,
the effort he
but we
made.
have the practical part, sorry for
Yeah,
that,
okay.
but I have to clarify.
No, yes.
You know,
valuable
I tell
information.
you,
This point, very, very
Yes,
nice.
very
yeah.
important.
I spent 5 years on liposuction. I didn't do any single liposuction. but I have seen, I have attempted, I know the 5 or 6 techniques of separating the stem cell from the fat. 5 are mechanical, one or two enzymatic
Okay,
digestion.
Professor, can I ask you one point about this before you go? What do you prefer, negative pressure or just
I
syringe?
don't know the technique, that's what
What
I
do you
said.
prefer? Oh, you don't, no,
I am-
theoretically.
No, what I'm saying, I said, I will review the current 5 or 6 techniques of liposuction. And in each one, we will show you the amount and the number and the type of cells at the end of the day separated from the liposuction, and what is its clinical application, and what is the content of this stromal vascular fraction, and which one is superior to the other, and which one you can give intravenous and the other one is not allowed. So that's we will show the technique. My co-worker will come with me and he will show the technique. For me, I will present the science itself and how we doctor should know before getting this material from the technician and he give it to us. We should know what is inside that, because all are different, and what is the clinical application of each of it, and what is the value and the number of cells, and what are the combination of types of cells in each stromal vascular fraction. For me, I am a clinician and I need to know that, and I don't want to use it blindly. If anybody, you know, in the market, sorry again, I talk too much, in the market there are 6 machines and 6 medical reps come to you. I have a liposuction, this is $300, this is from Korea. The other one come, no, I can give you 200. This is from China, I can give you 150. The other one said, no, mine is 1,300 because I use collagenase. I separate the cells. I can give you 7 types of cells in the stromal vascular fraction, and you can give it
I
intravenous.
asked for a type of cell,
I can't
but
tell
of
you.
course I don't know
in
how
the
to do it.
lecture
I
it
don't
is
know.
there.
Yeah.
This is the point.
It's okay.
But
Yeah,
I
laboratory.
ask, I need this.
Laboratory.
Let me, can I add something for what you mentioned? Okay.
If the chairman allow.
Of course, I want. You know, when we use the negative pressure.
Let me make that announcement before you leave.
Yeah.
So it's better to use the syringe.
Yeah.
It is syringe. Yeah.
Don't
It
use
is
the others. None, but they allowed to use this, and I look at them and I don't talk.
Let me talk about the we have a course, by the way.
Did you
That's what
finish?
the you know.
Can you clap for
Let me
that?
comment on since we started.
So, this is.
About this.
Where am I? Where am I?
You
This is a
started
good
to come.
picture.
You started to come this journey.
Okay.
And the other
Okay,
is this
so
journey.
you know we have a course gonna be
We should
started.
announce the course.
Yeah, on the 16, 17, 18.
Yeah.
And you know, Dr. Kawan, the director of the course, and we have 17 speakers. Gonna be cover all aspect of stem cell application and you know also technique, and you know that will make you prepared to be American Regenerative Medicine Board, and this will like more like preparation for that, and this will be more like followed by 2 months of discussion online plus maybe online lectures and group, and then we're gonna have also preparation for the board examination. When you are taking all this, you can take the board exam here, the written one, and then you can get the oral as well. After you pass this, you'll become, you know, American Board of Medicine certified. And naturally, diplomat.
So I just today I received the certificate of the membership
Yes.
in the
Society.
newly
Congratulations.
society membership, yes, and the newly prepared board, which is the dental regenerative medicine.
Yes, nice.
I'm
Very good.
preparing. Yes, I'm preparing for the exam, so the
Yeah.
course will be very valuable for me. I was
So that will be really something we are, again, something like that, but much more an academic, level,
background.
you know, and, Dr.,
I'm giving the first lecture.
she gave the first lecture, the most difficult
Of
one.
course.
And, many lecture for Dr. Kiwan. So we have really many speakers who can speak about this, and I encourage everybody to really join because, again, this is a new field And as you see, really like East and West, they do this way and this the way, and I feel like
Controversial.
not very standardized it, and that's why like FDA coming across like, you know, we need this stabilized study. And so I believe, you know, it's very good to get ourselves and have a lot of application in us, like rheumatology. We're talking about case, you know, I mean, he treated himself and like, wow, you know.
Yeah.
So again, you know, I recommend and to attend this course. We can send you invitation if you are interested to register. We have only a few days left to start actually next week.
On 16, we have also a lecture I just prepared today on the DHA regulations. Because DHA regulations like 72 pages and it's very vague, really very vague. And I was involved in version 2 in writing the. So I'll present the lecture, and it is very important that before we know we are allowed or not, what is the FDA, what is the DHA, what is the European, and so on. It will be interesting, I think.
Yeah, it is a beautiful kind of preparation for somebody who is interested to enrich, and could be just by his lucky accident, like ozone, he did it, and just we do just like that, you know. And we are as a group here, we're really passionate about stem cell, you know, and really, unfortunately, we use it clinically, and we have a lot of good results. So keep using it, but you know, again, we're building our own experience, you know, and with our patient.
Now, the last question to you, all these studies are Bell's palsy.
Yes.
What about central?
No, it's
No-
not
no study.
published in
That's a
Europe.
study. Yeah, we're gonna take pictures,
Okay.
tradition outside, we take pictures, you know, outside. Okay. So now you'll be in the picture.
Okay, that's cool. Okay. Thank you.
Welcome.